Whether consuming soy as somebody with endometriosis is good or bad has long been a controversial topic. Many people are still falsely under the impression that soy contains estrogen. Spoiler alert, it does not. Or that because it has estrogen receptor binding potential, it will throw your estrogen levels out of whack and make your endometriosis worse. I'm not here to convince you one way or the other, but only to bring you the facts so you can make an informed decision for yourself. Should you be avoiding soy as somebody with endometriosis? Let's talk about it. And please share, like, and subscribe, especially share this one so that we can start busting some misconceptions together. So what is a phytoestrogen? You may have heard the term phytoestrogen being used interchangeably with soy. The generic name phytoestrogen refers to a group of non-steroidal phenolic plant compounds. There are three main classes of phytoestrogens, including flavonoids, which contains purin, genestin, cholesterol, EGCG, neurinogen, quercetin, isoflavones under that flavonoid umbrella. There's also lignans and stilbenes, which encompasses resveratrol as a type of phytoestrogen. Phytoestrogens are found in a variety of vegetables, fruits, grains, and especially soybeans and related products such as tofu and soy milk. One of my favorite points to make when debating over the safety of phytoestrogens for endometriosis patients is that so many other non-soy foods contain these plant compounds, including but not limited to flax seeds, sesame seeds, various types of multigrain breads, garlic, mung beans, dried apricots, pistachios, dates, sunflower seeds, and so many more foods. So what's the deal when it comes to phytoestrogens, soy, and estrogen? Dietary phytoestrogens are structurally similar to estrogen, but this is very, very different from actually containing estrogen. The structural similarities allow these phytoestrogens to bind to estrogen receptors, but what researchers have found is that the binding affinity of dietary phytoestrogens to estrogen receptors is much weaker than the body's natural estrogen. In fact, the researchers in this study ranked the estrogen strength of estradiol, E2, against phytoestrogens for estrogen receptor alpha and estrogen receptor beta, and found that naturally occurring estradiol had far greater strength when bound to estrogen receptor alpha, followed by cholesterol, genestin, ditsin, biocannin A, and formonetin. For estrogen receptor beta, again, estradiol binding was in first place. It had the strongest binding affinity to estrogen receptor beta, followed by genestin, cholesterol, ditsin, biocannin A, and formonetin. It's noteworthy that cholesterol had the second strongest binding affinity to estrogen receptor alpha, and while very few comestins have estrogenic activity, the ones that do are largely found in legumes, not soy. Furthermore, another study showed that while the binding strength of genestin to estrogen receptors was comparable to that of natural estradiol found in our bodies, the concentrations required to induce an action upon binding was 10,000 times that of 17-beta estradiol. So translation, phytoestrogens can bind estrogen receptors, but are much weaker than your body's natural estrogen, and larger amounts are required to induce a change from that estrogen binding. Another thing that this suggests is that if you have enough displacement of your natural stronger estrogen by dietary phytoestrogens on estrogen receptors, you can reduce estrogen excess symptoms. Conversely, if you have low estrogen, like in the case of a postmenopausal state, increasing your intake of dietary phytoestrogens may relieve symptoms of estrogen deficiency. So what kind of research do we have about soy, phytoestrogens, and endometriosis specifically? Spoiler alert, we don't have a whole ton. This 2007 study in infertile Japanese women showed that a higher intake of soy was associated with a reduced risk of endometriosis, specifically advanced endometriosis. So next I'm going to break down some of the findings from this systematic review, which included 7 human studies, 22 in vitro studies, and 38 in vivo animal studies about that connection between endometriosis and soy. So for the purposes of this video, I'm only going to highlight the results that pertain to phytoestrogens highest in soy soy products specifically, since the topic is more on soy phytoestrogens and not other classes of phytoestrogens. But if you are interested, the systematic review is a great read, and it's very comprehensive and highlights a lot of beneficial effects from many other different types of phytoestrogens. In the in vitro experimental human models, which would include removal of endometriosis tissue or cells and applying treatment or analysis to it outside the human body, this body of literature showed a few interesting results. Now, keep in mind, this is not a comprehensive list. So specifically, when it comes to the phytoestrogens that we're most concerned with that are found in highest quantities in our soy products, those phytoestrogens were shown to not reduce aromatase activity in endo cell cultures. So in other words, they did not block the conversion of androgens to estrogen. Genestin did increase aromatase activity in controls. Phytoestrogens, so specifically again the ones we're referring to in most concentrated amounts in soy products, were shown to block adhesion of endometriosis cells to neighboring cells. So that is a huge positive finding. And isoflavones were also shown to block endometriotic cell migration. So these are in vitro studies. The applicability of this in human studies would be quite profound, but we're not quite there yet. In vivo experimental animal models measuring the effects of non-oral intake of phytoestrogens also showed a few interesting findings, including genestin was shown to increase uterine progesterone receptor expression, which would be excellent if translated to results in humans, as progesterone reduces estrogen receptor activity, is anti-inflammatory, and is anti-proliferative. One study showed no change in blood flow to lesions with the administration of genestin. And keep in mind, in these studies, this was not like oral sources of soy or dietary sources of soy consumed orally. They were administered in some other way. Supplementation with soy-based supplements has never really shown good results from the research that I've seen. And full disclosure, I do not support or encourage the use of soy-based supplements. This is something that I've always kind of maintained as one of my professional opinions. In one animal study, a commercially prepared phytoestrogen supplement was administered to adult female rats in doses comparable to those found in Western and Asian human adults. The supplement was observed to reduce sexual motivation and resulted in aggressive and anxiety-related behaviors. In vivo oral intakes of phytoestrogens in animal models showed a few things. So this is just giving animals dietary sources of phytoestrogen by mouth. So in vivo oral intake of phytoestrogens in animal models showed a few interesting findings. So this is just a little bit of the research summarized about the oral intake of phytoestrogens and the effects it was having on the bodies, inside the bodies of these animals. So firstly, higher intakes of genestin, which is one of the phytoestrogens we find in soy, increased uterine progesterone receptor beta. So again, I've mentioned this previously, if this translated well to human studies, this would be very positive, as progesterone receptors reduce estrogen receptor activity and help with promoting an anti-inflammatory and anti-proliferative environment. And the other finding was that there were smaller lesions observed with consumption of genestin. So what about the human studies? In a roughly 1,200 participant human study over 6 years, intake of genestin and Dietzen were shown to decrease risk of hysterectomy due to pain. This study in Iranian women assessing the effects of isoflavones, lignans, and cholesterol over 1 year showed a reduced risk of endometriosis with the intake of these phytoestrogens. So what are some other things to consider? We have limited research about the endo and soy connection, and that's undeniable. So what can other literature tell us about whether soy is health promoting and something that we could be safely consuming as people with endometriosis? This study summarizes some of the pros and evidence of health benefits in humans. And this is sort of just a brief summary of some of the findings. So phytoestrogen consumption may reduce hot flashes and night sweats in menopausal women, but the research to date is not very strong. Studies do exist showing better bone health in menopausal women consuming high quantities of soy foods. A 2009 meta-analysis of randomized controlled trials found only a weak association between soy isoflavone intake and better bone mineral density. Could this be applicable to fertile women taking bone density reducing hormone therapies like Orilissa? This is just sort of a thought that popped into my mind when reading this literature. Other human studies with soy interventions do show reductions in LDL cholesterol or low density lipoprotein cholesterol, which can translate to less inflammation or less body-wide inflammation, and possibly lower cardiovascular disease risk, although again, the literature here is not solid. What about breast cancer risk? The literature here is mixed. One study showed that higher blood levels of genistein was associated with a 32% reduced risk of breast cancer. Another study showed that the risk of developing breast cancer dropped as soy intake rose in Asian women specifically. An older study from between 1978 and 2004 found a protective effect in premenopausal white women, specifically when it comes to that cancer risk. One study found that isoflavin-rich soy products decrease FSH and LH, which is your follicle stimulating hormone and luteinizing hormone, in premenopausal women, which resulted in an increase in cycle length. This may have positive implications for endometriosis sufferers if this also translates to stronger progesterone levels in the luteal phase. This study may also act as a warning to some women attempting to become pregnant or who are already experiencing menstrual cycle irregularities. Because of the size of infants and the concentrations of phytoestrogens absorbed from formula, this is one area I personally have a lot of questions about. Research shows that infants fed soy-based formula had circulating phytoestrogen concentrations 13,000 to 22,000 times higher than their own endogenous estrogen. And of course, as little infants, they're not producing very much. This equates to 50 to 100 times higher than the estradiol levels in pregnant women and roughly 3,000 times higher than the estradiol levels at ovulation. And literature has already observed estrogenic activity in infants fed soy-based formula. So this is maybe one area I would definitely approach with caution. A summary of clinical studies on soy showed that it had more positive results for maintaining bone density, cardiovascular benefits, cancer prevention, hormone levels, and menstrual cycle health, immune health, and neurological health. So we do have some literature to show that consuming dietary phytoestrogens has some positive health effects in other areas when we're not also factoring endometriosis into the picture. Additionally, there's a whole other body of literature about the health benefits of equal. Certain gut bacteria can convert soy isoflavins into equal in the gut, making it almost like a supercharged isoflavin, showing even more benefits for bone health, cardiovascular health, and menopause health benefits specifically. Last points I want to make about soy. So the first one is that soybeans are one of the most concentrated sources of phytates. So phytates can bind to other nutrients, preventing absorption and essentially robbing you of those nutrients. And this is concerning because as somebody with endometriosis, one of your main objectives should be maximizing nutrient absorption so that you have more of that antioxidant, anti-inflammatory nutrition to help you fight body-wide inflammation. The solution here though is quite simple. Opt for fermented, sprouted, or soaked options if you're going to be consuming soy as part of a healthy diet. All three of these quick methods of processing significantly remove the phytate content in soy. Miso, tempeh, natto, tofu, and soy sauce are already processed to make them nutrient-dense alternatives with much, much fewer phytates. Next thing I wanted to mention, we do have some literature around the possible negative effect that soy may have on thyroid function. So if you're somebody watching this video and you know that maybe you have some sluggish thyroid function or you've been diagnosed with Hashimoto's or hypothyroidism, maybe just consult with your doctor about whether you're going to have to tweak your medication dosage if you're consuming a lot of soy in the diet. There isn't a large body of literature showing that consuming dietary phytoestrogens will have a drastic effect on your thyroid levels, but we do have some literature showing mild changes. So you might just want to approach with caution and have a conversation with your doctor, your nutritionist, or your dietitian about this. And lastly, it's undeniable that soy is one of the most genetically modified foods in the world. It's estimated that roughly 94% of the soy produced in the USA is genetically modified to be resistant to the herbicide Roundup, which contains glyphosate. Even small amounts of glyphosate exposure is shown to be dangerous, particularly to the gut microbiome and the changes that follow from exposure of glyphosate to the large intestine microbiome. Going deeper into this topic topic is beyond the scope of this video, but it is an important aspect to bring up when discussing soy. For more information on the connection between glyphosate and your health, check out the book Toxic Legacy: How the Weed Killer Glyphosate is Destroying Our Health and the Environment. One alternative to a GMO soy may be an organic version, or perhaps sourcing it from a farmer that you trust. We've laid out the pros, cons, and considerations for soy. What do you think? Please be sure to share this video with a friend so we can spread awareness. Please also subscribe if you found this or some of my other videos helpful, and I will see you in the next video.